Afternoon. We have reached the final stretch of the day. I'd like to invite you to take a moment to reflect on the discussions we've shared. So this will be the roadmap of the talk. We'll wrap all everything, and I will talk about a little about ethical foundations. I'd like to mention about professional virtue, something that was referred to as self-regulation by our previous speakers. I'd like to introduce also a toolkit that you can bring home, not just your loot bag. We have a loot bag. We have this idea toolkit, and of course, a call to collaboration. So let's begin with a quick recap of today's topics. We'll move. Right, so the day began with an understanding of the definition, the scope, and ethical underpinnings of conflict of interest in healthcare. This was well discussed by Dr. Renzi Fernandez. I really appreciated your bullseye and all the implications, no? Very clear. And then we also explored disclosure mechanisms, institutional policies, including personal practices and strategies to minimize conflict of interest given by Dr. Valero. He mentioned about the defense layers, prohibition, which is very severe, just saying no to all conflicts of interest restriction, disclosure, and self-regulation. We also examined the implications of marketing strategies and the role of sales reps. Sana ako. Okay, and we reviewed national international policies given by Dr. Tranquilino. He mentioned about the local codes like the PMA code, the PCP code, and of course he's known for the Mexico policy. Dr. Elaine gave the real-world scenarios about prescribing, dispensing, supplying devices, and the implications of the complexities of COI in real-world scenario. And then we also discussed the temptations faced by our young colleagues, no, in finding their way in this field, no, in establishing their practice. So finally, we made use of role playing to enable our residents to walk in another's shoes and experience real-world application of conflict of interest and reflect on their learning processes. That's a very good job. Thank you for all the participants of this video. We've discovered new talents. Okay. So first off, let me ask, do you think that the current rules and policies, let me just hold this na lang. Okay, do you think that the current rules and policies are adequate to manage our conflicts of interest? All this day, we've been talking, are we doing enough? How come we still see a lot of people who are entangled in conflicts of interest and they're not even aware of? So yes, it's true that policies designed to mitigate this are important, but they often fall short because we are addressing complexities in human behavior. It's a human behavior. So every time we talk about conflicts of interest, there's a moral agent involved, human. So while these policies provide a framework of ethical conduct, they cannot account for the nuances of individual motivations and the unconscious biases we have that can influence our actions. Moreover, policies can only enforce compliance to a certain extent. They cannot instill a genuine commitment to ethical behavior. So I guess we all agree with that. So let me bring you back to some basics or fundamentals. At the heart of every clinical encounter is the therapeutic relationship between a physician and a patient built on trust. So this moral enterprise relies on the physician's ethical responsibility to prioritize the patient's welfare amidst conflict of interest by exercising sound judgment. Okay, so how do we judge whether our actions are right or wrong? Sometimes we don't know. Everybody's doing it. We see our mentors doing it, so, and what's wrong about it? So there are three traditional ethical theories. I'll try to make it simple. They're called the deontological framework, consequentialist, and virtue frameworks. Okay. So when you say deontology, the root word deo comes from the Greek word deon, which means duty or obligation. Therefore, in this framework, it emphasizes the importance of adhering to rules, to duties, to codes. See, we have a lot of codes. So they say that you adhere, okay, we follow the Mexico policy, we follow PCP. That does not make you ethical already, no? But in this framework, you're good as long as you follow them. So there are very strict policies against receiving gifts from pharma. Is adhering to this rule morally justified, even if it compromises your professional growth or development? Something to think about. Now let's go to the consequentialist theory or framework. This judges the action based on its results or outcomes. So they say that an action is good if the results benefits more than it harms, then that's good. Conversely, if it causes more harm than good, then it is bad. So example, doing cataract surgery with good outcomes is good. But what if those surgeries were done without the proper informed consent, without the proper follow-up care? So is that still good? Probably from the point of view of public health, then that's good. But in the personal level, you might have harmed a lot of patients. Okay, now the last framework, the virtue framework, which we would like to emphasize in this postgrad. It focuses on the person's character, traits, and qualities. This suggests that a physician is good. A physician with good moral character would naturally engage in ethical behavior and professionalism through consistent practice. Consistent practice. That's how you develop virtue. So professional virtue fosters a culture of responsibility and trust, encouraging individuals to act ethically out of a sense of duty rather than merely adhering to duties or to rules. And this internal motivation can lead to more consistent and meaningful adherence to ethical standards, ultimately reducing the likelihood of conflict of interest. When professionals cultivate virtues such as integrity, honesty, and accountability, they're more likely to make decisions that prioritize the greater good over personal gain, even when no one is watching them. Even when no one is watching them. That's what Dr. Valero has been saying, self-regulation. So, and as Dr. Santos mentioned earlier, virtues serve as a bedrock of professional self-regulation, particularly at the level of the physician. Virtues of the profession are those characteristics that enable us to achieve the goals of the profession. And in medicine, what is the goal? Our goal is to care, prevent, focused on prevention, healing, and palliation, with profit and prestige probably as secondary outcomes only. So no strategies or habits or policies will serve to support virtue if a professional is not first committed to the primary goals of the profession. So let's consider how crucial professional virtue is in situations involving conflict of interest. So at this point, I'd like to introduce you to the IDEA framework. The first step is to identify and gather all relevant information, get the facts. And this will help in grounding a focused, informed decision and eliminate uncertainty. Another important step here is to consider all those who will be affected by the decision. You call the stakeholders. The second step is to determine what ethical principles or values are involved or are in conflict. The third step is to explore your options. This step would involve considering your alternatives, when planning a course of action. So when you say, you can ask, does this action adhere to rules and regulations or hospital policies or codes of ethics? That's the ontological framework. You can also ask, will this action result in more good and least harm? That's consequentialist framework. And last, will this action make me or lead me to become the doctor that I ought to be? That's virtue framework. Now, after examining all the potential options, you can now act on a decision and reflect on its outcome. Okay, let's be ready. Are you ready? Let's try if this virtue will work or this framework will work. Okay, let's try. So we have Dr. Mata Pat is approached by a pharma company. This is a recurring theme, no? The whole day, it's the same thing, pharma, doctor. But let's see if this framework will work. So we have this doctor is approached by a pharma company that offers to sponsor a postgrad he's organizing to promote a new drug. And the company provides financial support, promotional materials, even invites a speaker for their team, from their team. Now, however, Dr. Matapat is aware that the new drug has mixed reviews regarding its efficacy and safety, and there are alternative treatments available that may be more beneficial for his patients. So first step, identify the facts. Dr. Matapat has been offered sponsorship, but he knows he's uncertain because there are other better treatments. Stakeholders, Dr. Matapat, the physician, the patients, the pharma company, and medical community. So the dilemma. Should Dr. Matapat accept sponsorship and promote the new drug knowing that it might not be the best option for his patients? Okay. So how must Dr. Matapat ensure that the best interests of his patients are protected in the pursuit of professional development? Okay, we have the several principles involved in this case. You have autonomy. You should consider promoting the drug. You should have an informed consent. Okay, the patient should know that. Beneficence. This means your obligation to act in his best interest, so he should evaluate whether promoting the drug aligns with the goal of maximizing benefits and minimizing harm. Non-maleficence, do no harm, must consider whether endorsing the drug could potentially harm this patient. Justice involves fairness, no? Should reflect on whether accepting sponsorship could create inequalities in access to care. And lastly, integrity. Is it crucial in maintaining, professional integrity is crucial in maintaining trust. So he should also consider how accepting sponsorship might affect his credibility and trust of the patient. So we have three options: accept the sponsorship. Option 2, decline. Option 3, accept the sponsorship with conditions. Okay. I based it on the three frameworks. You have the ontology, consequential, virtue. So in option 1, you accept the sponsorship. This may violate the ethical guidelines that stresses transparency and objectivity. Consequentialism, it may lead to increased awareness of the new drug, but could also mislead patients about its efficacy. And virtue, it may not align to the virtue of honesty and integrity expected of a physician. For option 2, decline the sponsorship. Okay, by declining the sponsorship, it adheres to ethical guidelines and hospital policies perhaps, but it might miss out on opportunities to learn about new treatments and potentially hinder the ability to provide the best care. And it might also align with Dr. Mata's virtue of honesty and integrity by declining sponsorship, but it might be seen as impractical and out of step with the prevailing culture. Now, the last option is accept sponsorship with conditions that ensure ethical integrity. So by adhering to the guidelines of transparency, he would fulfill his duty to act in the best interest of the patient. It could also lead to awareness that there's a new drug, while patients would receive well-rounded view of the treatment options. And lastly, this will align with his virtues of honesty, integrity as it stresses ethical responsibility while allowing professional growth. Okay, the golden mean by Aristotle. As we explore the complexities of conflicts of interest in healthcare, it is important to consider this concept of the golden mean. It's also known as common sense or practical wisdom. So, this principle teaches us that virtue lies in finding a balanced approach between two extremes. Okay, on one end, we have the extreme of accepting sponsorship without question, which may lead to biased decision making and lack of transparency. On the other end, we have the extreme of completely rejecting any form of sponsorship, which could limit access to valuable resources and opportunities for professional growth. So neither extreme is practical or beneficial in the long run. Instead, the golden mean encourages us to seek a middle ground, an approach that allows us to engage with the industry while maintaining our ethical industry. And by striving this balance, we can uphold the virtue of honesty, integrity, and commitment to patient care. So, Dr. Matapat decided to accept the sponsorship from the company and implemented specific measures such as balanced presentation, disclosure, independent review. He could ask his other independent experts to review the content of the presentation. And of course, patient feedback would be one of the strategies to incorporate a mechanism by gathering patient feedback on this new medication. Okay. Part of the framework is to reflect on the outcome. So after the seminar, Dr. Mata receives positive feedback from the attendees who appreciate the balanced approach, and the patients were happy, they were grateful. And by following the IDEA framework, the doctor navigates the conflict of interest by prioritizing the patient welfare and maintaining his professional integrity. Okay, that's it. So we did the framework. Due to the pervasive nature of conflict of interest, external policies, as you have seen, are not sufficient. And thus, the proponents of physician virtue says that there are 3 habits to counteract self-serving biases. No, we should implement Tao ethics. Time out. It means forming these questions in your mind. If the patient knows, will I be uncomfortable? Will they still trust me? So these are parang in surgery, you have your surgical timeouts. We also have ethics timeouts. Okay, then you can also do some consulting other colleagues for objective views. And third, automating ethical choices. When you say automating, automatic na. Pag may ganyan, out na yan. Okay? So this approach is underpinned only by the virtue of humility, which empowers the physician to acknowledge their limitations and prioritize patient care, which is the core goal of medicine, over personal financial gain. Okay. I want to acknowledge that the landscape of healthcare is complex, and many professionals, including speakers and sponsors, play vital roles in advancing medical knowledge. Accepting sponsorship can be a legitimate choice, especially when it supports education and innovation. However, it is crucial that we remain vigilant about the potential conflicts that it might arise. So a momentary pause to reflect on our decisions would allow finding the right balance. Our goal is not to criticize those who accept sponsorship, but to encourage a culture of transparency and ethical reflection. By fostering open discussion about these dilemmas, we can collectively enhance our practices and ensure patient welfare remains at the forefront of our decisions. So I encourage each of you to reflect on your own practices, dear young doctors. Consider how you can integrate this ethical framework into your daily decision-making process. So let's work together to create an environment of ethical integrity. where all voices are heard. So by sharing our experiences and insights, we can navigate these challenges and support one another in our commitment to ethical healthcare. In a world filled with potential conflicts of interest, let us keep our eyes open, for awareness is crucial as we navigate the complex waters of our profession. May our moral compass of integrity guide us in making choices that truly benefit those we serve. Together, let us embark and sail confidently into the future, knowing that our unwavering commitment to integrity will steer us toward the shores of trust and excellence. Salamat po.